Hi, Dr. Windisch here from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for parents. Today we're going to be talking about constipation in newborns. Remember that these videos are not intended to replace consultation with your physician. If you have concerns, please give us a call. We'd like to see you. We can be reached same day for consultation, 775-359-7111. So we get this call a lot about newborns, and I think the first important thing is to define constipation for a newborn. Normal newborn stools or bowel movements are anywhere between 7 times in one day, 1 time in 7 days, as long as what's coming out is soft or good. So just because a baby hasn't pooped in 2 days does not necessarily mean they're constipated. If the baby is having hard stools, then perhaps we do need to do something about that. The first thing that's important to realize, if your baby has been constipated from birth, that's very serious, and we as physicians need to know about that, and that needs to be called to our attention, especially if they haven't pooped or had difficulty pooping in the first 48 hours of life. There are a couple of diseases that can do that. That is not normal constipation of the newborn, and we want to know about that. Beyond that, if your child is an infant and having difficulty with hard poop, then the next thing to do is probably to introduce a little bit of first water, 1 to 2 ounces a day, and if that's not solving it, pure undiluted prune juice. Usually an ounce or two, once or twice a day of pure undiluted prune or pear juice will solve your child's problems. If your child is a preemie, we do sometimes use some glycerin suppositories, but for non-preemies in general, I try to stay away from anything used rectally because that can upset the babies and actually make things worse. Stuff fed orally tends to work a little bit better. If the prune juice once or twice a day is not sufficient to solve your problem, again, I want to know about it in my practice here because I'm concerned of a couple of intestinal obstructions that need to be closely evaluated for. Remember that baby food in general is constipating. So as your child gets introduced to rice cereal especially, that may cause constipation, and we may need to do something about that. The addition of prunes as the next food to be mixed with the rice cereal often will solve that problem. Again, enough prune juice or prunes will usually solve anybody's problems. There are some over-the-counter medications that can be used as laxatives. I do not recommend them for infants. That includes Little Tummy's laxative, which has senna in it. That includes Senna-Cot, milk of magnesia. I most strongly recommend against these. I also recommend for babies strongly against enemas, unless you've been advised to do so by your physician. There are some significant risks from all of these medications, including hypermagnesemia, hyperphosphatemia, and seizures, and in the case of the Senna and the Senna-Cot alkaloids, risk of actually dependence on the medication where you then need them in order to stool in the future. So please don't use these medications without talking to your physician first. I hope that this helps to kind of simplify a very common situation. And the most important thing to remember with this is, as long as the poop's soft, it's normal. Babies grunt, they cry, they turn colors when they poop. That's normal. Hard poop is not normal. That's what needs to be treated. If we can help you, give us a call at our office, 775-359-7111. This is Dr. Windisch from Sparks Pediatric and Adolescent Medicine. We'll see you next time.